sana. My name is Isaac Ndongo, and I I am a high school teacher. Been teaching in high school for quite a period of time. And someone told me about this business quite a number of years ago. That is 7 years ago, and I started off. And now, as they put it, the rest is history. I'm really happy. Because Jack, like each one of you, I went to school. And when I went to school, I was told to work very hard. And I was told if I worked very hard, I would also get very good grades. And that if I got very good grades, I would also get a very good job. And that job would take care of me. And so I hit the road. So I went and found myself in the university and became a teacher. And when I now became a teacher, I got a chance now to start teaching. And as I taught, somebody actually told me about this business in the course of my teaching. And it really helped me to start a different way of life altogether. And our business normally has three major parts. It has the issues of health. It has an issue of wealth, that is money. And it also has the issue of what we call the lifestyle. And then the basics in our business is using of the products, sharing of the products, and you share the product. And then lastly, there is a very key, of course, telling others, sharing the opportunity. And lastly, doing what we call training. And today we have a training, a wonderful training that is going to help you to get to know a number of things. And I am really looking forward also to actually listen to this. The person who is going to take us through this training has been in the business for a while. I have known her for over 20 years. Talk about 20, actually over 20 years I have known her. So you can be sure I got to know her even before she came over to the business. And I have listened to her teach and train, and she's really good at it. And this evening, many times when we are confronted by questions or some situations in our business, sometimes we start wondering what exactly to do if we have been missing on training. So, but now when we have been trained, we become sharp, we are better equipped, and things become better and better. So this evening, we have a wonderful presenter, but just before the presenter comes in, I also have my friend who actually made me join the business. And she's with me today, and I would want her to say hi to you. And so she's not very far from where I am. I think she's going to use my screen. So let her say hi to you.
Good evening, everybody. I'm so happy this evening to see all of you. You're most welcome for our training tonight. And as Isaac has said, you've been in this, my name is Spirit Dongo. We have been in this business for the last 7 years. And I'm so grateful to see what is happening every day, because every day I'm seeing people coming, changing their life, changing their story in terms of health, and even in terms of wealth. And today we are going to look at very critical area, because we are looking at our heart. Remember that heart is so key to each one of us. It's a very critical and very important organ to all of us. And we all need to have a very healthy heart. So we are going to learn how we are going to take care of our heart to ensure that our heart is functioning properly the way it is supposed to be functioning, so that it can serve us as many years as possible. So I don't want to say many things tonight. I just want to welcome everybody on board. I hope you've carried your paper, your book, your notebook and pen. If we have guests in our midst, feel most welcome. We love guests, we love everybody. We are one family, and we work together as a family, and feel so much welcome to this to our today's training. And I think without much ado, I want to welcome our speaker, a great speaker, a teacher by profession, who is going to take us through this great topic. And I know by the end of it all, you'll be able to understand. In case you have any question as the training is going on, I would request you to write it on the chat box so that we can look at it and see whether we can help each other to be able to answer your question. And I would also request the leaders who are here, in case you see a question which you can be able to answer, you can just still answer it on the chat box so that we can be able to move together. Maybe you can also tell us in the chat book where you are listening from as we go on. So thank you so much, and I want to welcome our speaker, our upcoming director, Nelius Thuo. So Nelius, you're most welcome. I hope you can hear me.
Yes, I can.
So I want to, thank you. I can see you are unmuted. So welcome, and just take it up.
Thank you, thank you, thank you.
You unmute your video too so that we can see you.
Yes, I will. I think now you can see me.
Yes, we can see you now.
Yes, hello everyone. My name's Nelius Thuo, and as PT Isaac and Purity have said, I'm a teacher by profession. Just as the story goes, each one of us was told to go to school, read hard, get good grades, and get a good job. And definitely that is what I did. As much as I've done a lot of my reading, even when I'm a mother and a wife as well. But with all the education and all the learning that I had done, there was one thing that was worrying me. Imagining that I will retire and look like the many teachers I usually see in my rural home, where after a teacher retires, the government pension takes a number of years before it comes. And even when it comes, it is, I don't know, a third or a quarter of what one was earning, not forgetting that the government salaries are not very high. And so I used to look at them and I would see this is not what I would want to be. And in the quest of looking for what I will do when I retire, that is when I came across this opportunity. In fact, when I was invited in the first place, I thought it is a lecturing classroom lesson that I would be given. But when I came, I listened and I found that it is an opportunity that one can do even when they are doing other things. And I've been there for almost 2 years now, roughly 1.5 to be precise. And I've enjoyed the opportunity, because though I came for money, I have enjoyed other benefits, especially health. I had some chronic challenges that I had seen the doctor for quite a long time. And you know, as they say, as you advance in age, some things keep coming over. You realize like when one is young, you can eat anything and you have no problem. As the year advances, those things that you used to eat and be comfortable, you feel you cannot eat them. And so I had some chronic issues that I was seeing the doctor, in fact, renowned doctors, and I could not really know what is eating me up until when I joined the opportunity, took just the products that were given for the kit opening, Provitality and Calmark. And within 3 weeks, my allergic condition that I had struggled for so long went down and up to date. I have not suffered that problem. Neither have I even gotten any common cold, which was like the normal for my life. And so what I'm saying is the short time that I've been there, I've enjoyed quite a lot. And that is why I am ready to push, because I know there are other benefits that I'll keep enjoying as I continue. So today I want us to discuss about the heart, because the heart is a very important organ of the body. And without the heart, obviously we know very well you cannot survive. If you lose your leg, you can still continue living. You can be given an artificial one. If you lose an arm, the same. If you lose your eyes, you can walk with a walking stick. If you lose your ear, your hearing, you can use the sign language. But if there is an issue with your heart, believe me, you cannot survive. And that is why it is important to take care of our heart so that we will enjoy life. And probably when we talk about the heart, it's unfortunate that I don't have the slide to show, but I hope I will be audible enough that you'll be able to listen and capture what I'm saying. The heart is a muscle or a muscular organ, just like any other organ of the body. Because when we talk about organs, we only know of what we can see physically, but there are other very important organs in the body that are inside the body, and they are very key. And so the heart is one of them. And it is a very small organ, because if you can hold your fist, the heart is the size of your fist. I'm sure you can see my fist. And if you hold yours, it will be like that. So the heart is the size of your fist, and it is located at the left side of your body, slightly behind the breastplate. So if you lift your left arm, you touch your left side, the heart is just inside behind that. That is where the heart is situated. And that is why it is important when you know where it is situated, so that when you get some pains, you are able to know exactly what could be the cause or what could be the problem. The work of the heart is to pump blood to all the blood vessels, or to all parts of the body. This blood is the one that provides the body with oxygen and the nutrients and remove metabolic waste. In other words, we are saying the heart is the pump of the body. It pumps the blood. Pumping the blood is the blood in itself is the one that carries oxygen. It is the one that carries the nutrients, and it is the one that carries the waste that requires to move out of the body. So it has those three major functions. Because if the pump does not work, it is just like the way we use the pipes, the water pipes. Because the water is pumped to go to wherever it is required to go. So the heart works in the body as the pump. So that is why it is going to pump the blood, and this blood is the one that carries the oxygen. It is the same that carries the nutrients, and it is the one that carries the metabolic waste that requires to move out of the body. So if the heart is not functioning, then it means you will not have oxygen. And obviously, if you don't have oxygen, you die. You are not going to have the nutrients. And it means if you don't have nutrients, the body is not going to function. The waste products that requires to move out. And if the waste is contained in the body, also some other challenges you come up. So that is why the heart is very important. Now, probably if you have your pen and your paper, I may ask you to draw a circle. Draw a circle if you have a pen and paper. Now, this is the problem of teachers, because they always tell people to do things. You draw a circle, divide it into two, right and left. I hope you have done that. And then divide it again into two, the upper part and the lower part. If you have done that, I'm sure you have 4 quadrants. I don't know the best word to use for that. But at least you have a circle which is divided into 4 quarters. The heart is divided like that. It has the left side, which has 2 compartments, and the left side that has 2 compartments. Now, the right side of it is the one that carries We call it deoxygenated, but in simple terms, we can say it carries the dirty blood. The blood comes from all over the body, having collected all the dirt in the body and all the oxygen has been given out, it comes to the upper part of the right side. And then it goes down. Between the upper part of the left side and the lower side, there is a valve. A valve is like a door. So let me use simple terms and say that there is a door there. So the blood comes from the body, it goes through that door, the valve, and go to the down or to the lower part or to the lower chamber. There, the heart pumps that blood now from there and it pushes it to the lungs. Why? The lungs are the organs where oxygen gets into. So the blood goes to the lungs to be purified, to be given oxygen, and from there again, it goes now to the left side where it is going again to go through another valve and go to the chamber. The left side of the chamber and the lower part of it is the most active one, and it is the most strong part that pushes the blood now again to all parts of the body. So when we are taking the blood pressure, when we are taking the blood pressure, can you hear me? Isaac?
We can hear you. The problem is somebody is trying to share something. Let me try.
Oh, that's why I was wondering what is
happening. We can hear you clearly. You can continue.
Okay. I was saying that like when you are taking your blood pressure, or probably you have an issue, you go to hospital and the doctor is taking your blood pressure, that left lower chamber is what is taken, because it has to pump with a lot of strength, because this is the blood with the oxygen and it is required to be pushed to all parts of the body. I hope probably we have understood that. And that blood now, the system is continuous. It is not like the way I'm explaining. The system is continuous, so it is dirty blood from the body to the heart, right side to the lungs, then back to the lower chamber, back to the body, and the circulation continues. Now, I was only giving that so that you may have an understanding of how it works, and probably for those of us who left the school the other day, they may have done biology and they may have had that kind of understanding. But for the rest, that's why I've given that simple explanation. Now, let me talk about the heart diseases. The heart diseases are so many, and so I will not talk about all of them, but I will talk of some few that may give us, or maybe like an eye opener to us. Now, when we have the issue of heart diseases, many forms of heart diseases can be prevented or treated with healthy lifestyle choices. So in other words, we are saying, as much as there are so many diseases that affect the heart, majority of diseases can be prevented. All they can be treated with healthy lifestyle choices. So the issue of the way we live, what we eat, what we do is a key factor as far as heart issues are concerned. One of the diseases of the heart is called cardiovascular disease. This is a disease that deals with the blood vessels. Now, when I was talking about the movement of blood, obviously it is moving through some pipes. And these pipes are what I'm referring to as vessels. And when we talk about blood vessels, that is what we are calling the cardiovascular. This condition in men They will detect it when they have chest pain. For women, they may have chest discomfort, they may have short breath, they may have nausea. When we talk about nausea, is that feeling of vomiting. You feel like you would want to vomit, although you are not vomiting. And also extreme fatigue, feeling like you are so tired, but you really can't tell why you are so tired. You may also have chest tightness. You feel like the chest is very tight, short of breath. You may have pain. You may have numbness. You may feel weak of the body, or you may feel some coldness in your legs or arms. That is if the blood vessels in those parts of your body are narrowed. If they are narrowed and they are smaller than the way they are supposed to be, that is when you feel cold feet, cold arms, and the rest. Under that, there is a condition we call stable angina. Stable angina is a pain in the chest which is caused by narrowed coronary arteries. The reason why you are going to feel the pain is because that prevents the heart from receiving extra oxygen required, especially when you are doing strenuous activity. And that is why if you are feeling that pain and you stop doing whatever you are doing and rest, the pain, you feel like the pain is not there. That is what is called stable angina. Unstable angina is when you have the same pain, but even when you rest, the pain is still there. That is the difference. The other disease or the other problem could be abnormal heartbeats. Abnormal heartbeats. This can be seen by the issue of chest pain or discomfort. Sorry. It is a condition where the heart beats too quickly, too slowly, or irregularly. Those are three things that the heartbeats can be slow, the heartbeats can be too quick, or the heartbeats can be irregular. How do we know whether they are too fast or too slow or irregular? One is supposed to have an average of between 60 and 100 beats per minute. So if it is below, then it means it is too slow. If it is above that, then it means it is too quick, or it may be in between. So that is what we are calling the abnormal or heartbeats. Symptoms for the abnormal heartbeats could be the fluttering in the chest. You just feel like there is a pumping in the chest, or racing heartbeat, slow heartbeat, chest pain or discomfort, shortness of breath, lightheadedness, dizziness, fainting or nearing fainting. So those are the signs that you can detect or you can experience when you have the abnormal heartbeats. The other one is heart defects. This one is congenital. When we talk about something being congenital, it means you are born with it. This is a dysfunctionality that took place when the baby was in the womb, and that is what we refer to as congenital. So there are some conditions of the heart that has such problems. In most cases, the midwife is the one who will even detect. Sometimes they might not tell you immediately, but depending with the condition, you may know even as you leave the hospital as a mother. The signs would be like pale gray or blue skin of the baby. Normally when the baby is born, the color of the skin should be pink. So if it is pale pink or blue, it means there is a problem. And that is why the midwife, the doctor, the nurses will be able to detect that very easily. There also may be swelling in the legs, abdomen, or areas around the eyes. Also, there can be shortness of breath during feedings. Like for example, if the child is, the mother and the baby have been discharged from hospital and it was not detected, when they go home or whichever time we are together, when the child probably is breastfeeding, you realize that the child is having shortness of breath. How do you know? Like if you are breastfeeding the baby, you put the breast in the mouth, just within a short time you find the child is releasing it because they don't have enough air. That is how a mother can tell. And these also lead to poor weight gain, especially if you are not quick to notice that the child is releasing the breast even before they suck enough. What happens is that after some few weeks, you realize the baby is not adding weight because they are not obviously feeding well because of that. Other symptoms that cannot be diagnosed early are not life-threatening, but those that are diagnosed early are life-threatening. Like for example, they easily get short of breath during exercises or activity, or easily tiring during exercise or activity, swelling in the hands, ankles, and feet. So those will be the symptoms or the signs of a child who has been born with a congenital condition of the heart. The other disease is weak heart muscle. Medical terms, they call it the cardiomyopathy. This is a condition of abnormal enlarged heart, thickened or stiffened, and as a result, the ability to pump is weakened. Now, for the heart muscle to pump blood, it must be soft enough so that it is able to squeeze and relax. So when one is suffering from cardiomyopathy, it means the walls are hardened or thickened, or they are stiffened, and therefore the issue of squeezing and releasing is not working fast. And that is why one is going to suffer from it. And as a result, the ability to pump is weakened. If the squeezing and releasing is not working the way it is supposed to be, it means also the supply of blood in the body will not be enough. And also the supply of oxygen will not be enough because the oxygen and the movement of blood works together. Symptoms for the cardiomyopathy is breathlessness, especially even when one is at rest. You may also have the swelling of the legs, the ankles, and the feet. Also, you may feel fatigued. Fatigued is when you feel tired, generally tired, but you don't have any good reason for why you are tired. Irregular heartbeats that feel rapid, pounding, or fluttering. Fluttering is like, I'm not able to really explain it, but you feel like the heart is just crapping, a kind of a crapping in the heart or in the, around the chest. One can also have dizziness, lightheadedness, or even fainting. All those are symptoms that one can experience when they are suffering from weak heart muscle or dilated cardiomyopathy. The other diseases we may talk of heart infections. One may have infections because of the several things that we are going to discuss. And this is what the doctors are going to call the endocarditis. This is the inflammation of the inner lining or the inner membrane that separates the chambers and valves of the heart. If you can go back to the circle that I had requested you to draw from the beginning, though we just drew lines, the vertical and the horizontal, where within the muscles, those are membranes. And so that is what we are referring to here when we are talking about infections, that if the inner lining or the inner membrane that separates the chambers have inflammation. Inflammation is like having a wound, yeah? Having a wound or the skin not being the way it is supposed to be. That is what we are referring to. So when the lining of the heart or the membrane have inflammation, all the valves is what I was referring to as the door. If they have inflammation, then there will be a problem. What are the symptoms for you to probably suspect that one has such a problem? One, they may suffer from fever, shortness of breath, weakness or fatigue. One may experience swelling in the legs and abdomen. Also the changes in the heart rhythm. You know, the heart beats in a regular way, so the rhythm changes. Dry or persistent cough. Also, you may notice skin rashes or unusual spots. So when you see any of those, it is a sign. That is why sometimes you go to hospital and the doctor just look at you and tell you to test, or you'll be given tests, those that they do for the heart. It's because doctors who are keen, they know those signs and they're able to suspect what one would be suffering from. The other infection could be in the valves. The valves, the doors that I was talking about, the valvular heart disease. Valves open and close to direct blood flow through the heart, and valves may be damaged by conditions leading to narrowing or leaking or closing, depending on which valve it is working on. I had talked about the membranes and I've talked about the valves. So what I mean here is that if the valve has inflammation, it may fail to open the way it is supposed to open to allow the flow of blood. It may be leaking. You know, if a pipe leaks, what happens? Or it may close completely. That tells you the functionality of the heart is not working properly. And because of that, there will be insufficient flow of blood in the body, insufficient flow of oxygen in the body, and obviously the results will not be pleasing. That is why heart conditions are an emergency. Because when these things happen, especially the issue of oxygen, and you can see, without the blood, there is no oxygen in the body, and without the heart pumping in the right way, then the blood and the oxygen will not be experienced. Signs that would help you probably tell that one is suffering from a problem with the valve is fatigue, shortness of breath, irregular heartbeat, swollen feet or ankles, chest pain, fainting, etc. I'm sure right now you are wondering, why am I repeating the same symptoms? It is because when any part of the heart is not functioning in the right way, then it means there is no required flow of blood and the issue of oxygen is not there. So that is why the symptoms are almost the same. Now, let me talk about the causes. All those are the problems that one may suffer from. The causes. Like for example, when we talk about the cardiovascular disease, this is why I talked about the blood vessels. What will cause that? As I had said earlier, this is a damage to the heart or heart vessels by a building up of fatty plaque that thickens and stiffens the artery walls and inhibit blood flow to the organs and tissues. So what I'm saying is, when we talk about the cardiovascular disease, what is going to cause the cardiovascular disease is the fatty plaque. All the walls thickening, all stiffening. And if that happens, then the blood flow to the organs will not be adequate. It can also be caused by unhealthy diet. Also, lack of exercise, being overweight, and those people who smoke. Yeah, cardiovascular, the issue of unhealthy diet, the issue of lack of exercise, the issue of being overweight, and those people who smoke. Those could be the causes of cardiovascular disease or blood vessels. The other cause, the other problem, what we were talking about, the heart arrhythmia, this is the cause of that condition could be what we have discussed as the congenital heart disease defects, where we said this a child is born with them, or it could be a problem with coronary artery disease, or it could be caused by high blood pressure. It can be caused by diabetes. It can be caused by smoking, excessive use of alcohol, or those people who take coffee or other caffeine products, people who abuse drugs, stress, those people who are also always very ready to buy over-the-counter medications, those people who are quick to using herbal remedies and dietary supplements. Here, I want to be very clear. When I talk about dietary supplements, I'm not talking about the Neolife products. What is the difference? The Neolife products are processed scientifically. There is a science advisory board that is able to do all what they are required to do, placing the requirements of a human, the consumption of a human body, and that is why this is not what is going to endanger us. But when I talk about dietary supplements, what am I talking about? Back in the village or even around us, there are people who go around with some jerry cans, selling some products. You are told it is going to heal you this, it is going to help you this. You are given, you buy a food bottle or even a glass, you are given a glass and you take the whole of it. The challenge is you don't know the content. It may be a healing supplement, yes, but you don't know the content or whatever is supposed to heal you. And obviously, we know that too much of everything is poisonous. All, like there are these, what do we call them? Moringa seeds. They are very famous, especially I think it is I hear it is a tree in Uganda, and people take those seeds. You may take too much and you don't know that. Nobody has tested to see the quality or the quantity of the ingredient that is supposed to heal you. All, there is another tree I used to hear people calling muarobaine. I don't know, that's a vocabulary, yeah? The muarobaine. And like if you are suffering from malaria, leaves are put and they are boiled and you are given and you are told to drink. I don't want to say that these products are bad. No. The challenge is who tested? What measure are you supposed to take? That is the challenge. So when you take these things beyond what the body is able to take, that is now why they will be suffering in one way, or it is going to cause other bigger challenges in your body. You may be healing one problem, but you are creating another bigger problem, especially that problem of the heart. Also, the other one would be like the valvular heart disease. I talked about valves, so if one is suffering from one. A person with a normal heart can only be triggered by such kind of things that are going to trigger the problem, and the problem makes you more weaker or you suffer more. The other cause is the congenital heart disease. This one I had talked about it. I think I had explained quite about it, where this is a defect developed after a month after conception. Remember I had said congenital means this is a condition that is happening or taking place when a child is in the womb. So immediately after conception, that is now when these challenges start. And the issue is the changing the flow of blood in the heart, and some medical conditions or medications or the genes can be the cause. In other words, I'm saying it may be genetical for you to suffer, for the child to suffer this, or it may be a medical condition. Either the mother is suffering from a certain medical condition and therefore it affects the fetus, or some medications that are taken. And that is why there is a rule, especially to expectant mothers, and I want to address them, those that are listening to me, and the mothers to be, that is, when a mother is expectant, you are not supposed to take any kind of a drug unless it is prescribed by the doctor. Even if you feel a headache, please don't buy Panadol from the counter and use. You may be endangering your life and the life of the fetus. The other cause would be the cardiomyopathy, the thickening or enlarging of the muscles. Dilated cardiomyopathy causes are not known, but they have reduced blood flow to the heart, resulting from damage after a heart attack, or infections, or toxins, and certain drugs. It enlarges the left ventricle. Ventricle is the lower chambers. As we drew the circle, the lower chambers are called ventricles. So I'm talking of the left. And when it enlarges, then it means it is not functioning in the right way. The heart muscle becomes abnormally thick, and this can be inherited or developed over time because of high blood pressure or aging. As we continue aging, some of these things are going to happen to us. The other one is heart infections, causes of heart infections. This is caused when an irritant like bacteria, like virus, or chemical reaches the heart muscle. And the most common infections are caused by the bacteria, by the viruses, or parasites. For the valve, it can be caused by congenital, it can be caused by rheumatic fever, it can be caused by connective tissue disorders. As I had said, there are so many conditions of the heart, but I will not deal with all of them because of time. And so I want to talk about the risk factors. Those people who are more at risk than others. One is age. I've kept saying as we keep growing old and older, some of these conditions may have a toll on us. Also, the sex. When I talk of sex, I mean male or female. Men are at a greater risk. I don't know the reason. Probably if there is a doctor on this call may help us. But for women, their risk increases as they age, and especially after menopause. Menopause is usually 51. According to the books, a woman is declared to have reached menopause when they get roughly to 51 and they take a full year having not received their menses. So after that, that is what we are saying, they may be at risk of suffering from any heart condition. There may be family history. This is what we are talking about, genetical. those people who smoke, they are likely to suffer from any of those conditions. Reason is most cigarettes have nicotine, and the nicotine constricts the blood vessels. It makes the blood vessels shrink, if I would use that word for better understanding. It makes the vessels shrink, and when they shrink, obviously the flow of blood, the flow of oxygen will be reduced. Carbon monoxide in the cigarette also damage the inner lining of these muscles. Also, when people are going through chemotherapy, certain chemotherapy drugs and radiation therapy for cancer increases the risk of cardiovascular disease. And as we know, most of the people who die of cancer, it is not the cancer itself that kills them. They are killed by other opportunistic conditions. So one of them is the radiation and the chemotherapy. Another cause would be poor diet. Diet high in fats, diet with a lot of salt, a lot of sugar, and cholesterol can contribute to the development of heart disease. So when we talk about the poor diet, we are talking of poor feeding, especially our young people who really like using a lot of salt. Sometimes you serve somebody food, and even before they taste the food, they ask you for salt, or you find them putting salt, even when they don't know whether the food had salt or not. So that is a risk factor. Also, those people who are suffering from high blood pressure, if it is not managed, it can result in hardening and thickening the arteries, narrowing the vessels through which blood flows. As I keep repeating, when the blood vessels are narrowing or thickening, it means the functioning is not optimal, and it means you not have enough flow of blood, enough flow of oxygen, and that brings the problem. There is also the risk of those people suffering from diabetes, people suffering from obesity, people who are inactive. You leave the house, use your car, go to the office, sit the whole day, leave the office, get to your car, back to the house, sit down. That kind of life is dangerous. Also, those that are suffering from stress, and also the issue of poor hygiene can also have a problem. What are the complications when one is having a heart problem? Complications could be heart failure, where there is failure to pump enough blood to meet the body needs. And this can be caused by heart defects, cardiovascular diseases, valvular heart infections, and cardiomyopathy. Heart attack, in many occasions, or in many cases, heart attack is a blood clot blocking the flow through a blood vessel that feeds the heart. Other complications would be stroke. Stroke is caused by narrowing of arteries in the brain, or blocked, or arteries being blocked, so that too little blood reaches the brain. Brain tissue begins to die just a few minutes of stroke. The other complication would be aneurysm, a bulge in the wall of the artery, and if it bulges and then it bursts, it causes the threatening of internal bleeding. The other one would be peripheral artery disease. This is where legs do not receive enough blood flow, causing leg pain when walking. The other complication would be sudden cardiac arrest. Cardiac arrest is sudden unexpected loss of heart function, breathing, and consciousness. How do we prevent all these diseases? Remember from the beginning I said that many of the heart conditions can be prevented by change of lifestyle. And so many of them are lifestyle changes. One, you quit smoking. Remember, I've talked about the caffeine and the carbon monoxide. Also, control other health conditions like the high blood pressure, the high cholesterol, the diabetes, and the like. It is always good to seek medical attention and to follow when one is suffering from such. Exercise at least 30 minutes a day. When we talk about exercising 30 minutes a day, we always say that the 30 minutes you must release a sweat. Even if you are walking, you have to release a sweat. If you have not released a sweat, then it means the body has not really exercised. You only moved your body, but that was not really exercising. So the 30 minutes we are talking about is when you release a sweat or you breathe fast. Yeah, you feel unahema, you're panting. That is what the 30 minutes is talking about. The other thing is eating a diet that is low in salt, saturated fat, and all those sugars. Yeah. You also maintain a healthy weight, maintain a healthy weight, reduce and manage stress. There are so many stressors, especially in this day and age. So it is good to learn how to manage. Also, you practice good hygiene. You can see all those preventive measures that are lifestyle based, and every one of us can be able to do that. Now, when are you supposed to see a doctor? Because everything might not be preventive, as we have said, because like when a condition is congenital, obviously it is not in your effort to prevent that. Seek emergency medical care with the following symptoms. If you have chest pain, or shortness of breath, or fainting, you are supposed to seek medical attention. Now, because of all the others that we had mentioned, Neolife products helps one to keep the doctor away by doing the basics. Here, I always say, any other advertisement on what do I call them? Medicines or such products, they will advertise them, they say how good they are, but they will tell you if symptoms persist, seek medical or see a doctor. But what are we saying in Neolife? Let's build wellness rather than treating diseases. I will repeat that again. Let's build wellness rather than treating disease. How are we going to build wellness? By living light, as I've said, and also taking the Neolife products that are going to help us take care of our bodies. Now, let me talk about the products that can help us be able to keep away some of these conditions. The first product that I want to talk about that is very good on heart issues is PhytoDefense. PhytoDefense has 3 combinations. It has carotenoid complex, it has flavonoid, and it has cruciferous plus. It is packaged in a sachet. Carotenoids are 3 in that sachet. Flavonoids are 2. Cruciferous is 1. So when you take that combination, you are going to help your heart. Why? Because the carotenoid complex boosts immunity. It boosts immunity by 37% in 20 days. That means that all heart infections that can be caused by bacteria, virus, or parasites have no entry into the heart or into the body. Because if your immunity is up to standard, if your immunity is at its optimal functioning, then it means any bacteria, any infection that gets in is fought, and therefore you will not suffer. So that is the advantage of the carotenoid. Also, it protects the body from free radicals that damage the body cells, and also provides the nutrient density and diversity of the 25 carefully selected fruits and vegetables. So when you take one sachet of phytodefense, you have a lot of prevention that you have done to the heart. The other product is Salmon Oil Plus. It breaks down cholesterol and it cleans arteries and it improves the blood circulation. Obviously, when you revert back to what I have explained about the blood movement and the like, you see what the Salmon Oil Plus does. Product 3 is Garicarium complex, which you are supposed to take 2 tablets daily. This one assists in maintaining blood rebates. It protects against cardiovascular disease or the blood vessels. It lowers the level of the bad cholesterol and increases the levels of good cholesterol. It strengthens the immune system and promotes formation of antibodies. When the antibodies are formed, again, it means any foreign bacteria that comes into the body, it is fought and you will be well. The other product that is very good in the heart program is TNN. TNN helps in cardiovascular development or the blood vessels development and granular activity. It helps the cells function more efficiently and promotes efficient nutrient utilization. When you take TNN helps to soften the cell membrane. And when the cell membrane is softened, the nutrients that are required to go into the body goes in, and the waste products or the metabolic waste that is supposed to come out of the cells gets out. And so when this happens, then the functioning of the heart takes place. The other product is lipotropic adjunct, which one is supposed to take between 2 and 4 tablets. This improves the cardiovascular health or the heart and the blood vessels. It emulsifies fats in the blood to be mobilized throughout the body where needed. When we talk about emulsifying, we are saying it makes the fat lighter so that it is able to move rather than being in one place. It also delivers specific nutrients, like, specific nutrients to helps to other parts of the body, and it is also involved in the production of the DNA. The other product is vitamin E. One is supposed to take 1 capsule daily. It prevents or delays coronary heart disease. It helps prevent the formation of blood clots that could lead to heart attack. It lowers the rate of heart disease with 30 to 40%. That is a very good product, especially for us who are advancing in age, because you can see it has a lot of protection. And the last product in that is the CoQ10, which supports the cardiovascular health. So I think I've talked quite enough. So back to you, PT Isaac. PT Purity, PT Isaac.
Here I am, Nelius.
Thank you. Back to you.
Thank you so much. This is awesome and great, wonderful. I can tell you, when I look at the chat box, I'm only seeing congratulatory messages. In fact, I've not seen any question, meaning that you've been a great teacher. You have researched so well. In fact, when we listen to you, we start wondering, are you a trained teacher or a doctor, Lily?
I think I can be both.
I tell you, for sure. And I always tell you, actually, you are a doctor, because even by learning, you are a doctor. you are an upcoming doctor in masomo pia. So that is great, Nelius. We have really learned a lot about our heart. In fact, I've written like 3 pages of the notes. I have followed word by word what you have said. And I want to believe everybody listening to Nelius this evening, you have also written the notes, you have learned. And from now, you can be able to help somebody who has these conditions of the heart. It's very, very key to take care of our heart. Even if you are not sick, do what we have been told to do today. Make sure that you're keeping your heart healthy so that you don't find yourself having these challenges that you have learned today. So Nelius, we really thank you so much. I don't think I can see any question on the chat box. The only question I saw was somebody asking to mention the product that you had named first, which I believe it was quite defense. Yes, and you have elaborated the content of the phytodefense. You've talked about the Salmon Plus, the Garrick, the TRNN, and the Ripotropic, vitamin E, and CoQ10.
Yeah.
I think those are the products that she has talked about, very powerful products. Take them, even if you don't have the disease, use them. And I say that when you are a member in your life, just be experimenting on all these products, use them. If you are a lady, the only product you cannot take is masculine herbal. If you are a man, the only product you cannot take is feminine herbal. Otherwise, the rest, you can use all of them. And when you use, you will take care of your heart and every other organ of the body that is very key, and every organ is key anyway. So for me, I don't think I have much to say, just to thank you so much, Nelius, for your time, your passion. You are a senior manager, and yet you are talking like a world team member.
I am
so
going to
our
be
prayer is that, yes, our prayer is that you become a director very soon, and even you go beyond. And I know that God will answer those prayers. And again, congratulations, Nelius. This month I've seen you have hit 1,000 points. That means you are sharing the products, and you are also you are moving towards becoming a director, and that is great.
Amen.
Yes, so I think maybe it's just an announcement to tell you that today was the calendar last day of the month. That is New Life last day of the month. But tomorrow we have what we call the World Team Day. The World Team Day still means that you can still do your order if there is something that you remain to do. You can still do that step up that you really wanted to do. You can still register somebody, imagine, tomorrow. You can still register somebody, but do it early. Do it early as by 12 noon. Make sure that everything is in order. Make sure that you have checked on your points. I always tell people, check on what we call the boundaries. It is very bad for you to close at 980 points. Well, you could close at 1,000 points and change your check or your earnings. It's very bad for you to close at 1990 when you can add 10 points and close at 2,000 points. So check your boundaries, check the goal that you had at the beginning of the month. Have you met your goal? And don't stop there. Work it out. I tell people, work it out. It's not over until you win. Make sure that you work your business tomorrow. Make sure that you call somebody. Make sure that you help your success line to close the boundary and to do something tomorrow. And I believe by the end of it all, we have a lot to celebrate, by the way. This month, we have a lot to celebrate. People have made steps. People have become, we have many directors this month, and we really thank God. I'm not going to mention them right away, but we have many directors this month. We have people who have made their world team steps this month, and it's just great. I'm really excited about the team. I'm really excited about what is happening in the team, and I thank you, all of you. I really thank you so much. It is because of the contribution of each one of us. That is why we have been able to do this. And as I've said, it's not yet over. You can still do something. You can still make up your step tomorrow. So let's continue working until tomorrow. And on 12, that is next Saturday. Yeah, next Saturday, 12 is when we shall be having our recognition. We've been doing our recognition. So just an announcement I'm making early that on 12, we shall be having our recognition. And therefore, let's be getting ready. And it's very good for you to be recognized that you did your 3 in 30. that you became a blood new qualified senior manager, that you became a blood new senior manager or manager, or even a qualified distributor, and you became a director. So let each one of us be somewhere as we close this month. So for me, I want to say thank you, and I want to wish you a very good night and a blessed night. So see you tomorrow, and have a great night. Thank you, and God bless you.